Are all pulse modes the same on all diode lasers?
No. Many lasers and some manufacturers still use old technology with pulse mode, repetition rate 10 to 25 hertz, and they use very long pulse, and it's just decrease of the average power. It has no merits like gentle pulse, for example, and I consider it just quasi continuous mode, and these lasers are not qualified for gentle pulse operation.
Are all lasers on the market tested to medical standards, and if not, why?
Luckily for many laser manufacturers, FDA is not that stringent with requirements for dental industry. Therefore, there are some gray areas where some safety features may not be applied, and to save money and save time in manufacturing, so these features are not applied. But we always apply, and our lasers satisfy the strongest, the stringent FDA requirements.
A burning question: why don't you manufacture a small wine type laser?
Very good question. We don't, and we won't do it. Our major concern, actually, there could be again two fields. One is the technical field, and the second is medical field. In technical field, all the small portable lasers, they have a drawback. Means that particularly micro lasers, the laser tubes may not be cooled, cannot be cooled efficiently, and in this case they always work at high temperature, and everybody who is in the semiconductor business say, well, in this case a lifetime of the laser will be 10 or maybe even 100 times shorter than for diodes, laser diodes, which are cooled properly. And the second, most important from my point of view, and very important for all dentistry, is medical field, sterility of the laser. And for one type, micro lasers, is just impossible to properly disinfect it. The proper disinfection for that type of micro or portable laser is just put in autoclave, and one procedure will fry it practically, or maybe just several autoclavings, and that's it. Laser is done. So your several $1,000s will go up into the smoke. And in this case, we don't do it. But application, some critics may say that, well, now we have developed several liquids, several gels for disinfection. Unfortunately, there's still not enough to do reliable disinfection between the patient.
Not to mention that the tips on these small ones are very expensive.
Excellent question. Excellent question. It's another what I would like to end our interview. That now it's very fashionable. Very nice marketing is done for that. So-called fiber tips means that when you don't have a simple fiber cord, you have a fiber cable ending with a special handpiece, and then you attach fiber tips for that handpiece. Marketing is so nice that sometimes I can just land on that advertisement. Unfortunately, when you do arithmetics, take a piece of paper, take a pencil, put everything on the paper, and you will see that if you multiply $5 minimum what these fiber tips cost by number of procedures you do, in 1 year the cost of all these accessories will exceed the amount you paid for the laser. This is very nice trick by laser manufacturers. Second thing, again, medical. Now first it was economical. Second thing is medical, sterility. It's practically impossible to reliably sterilize this fiber cable with the ending handpiece. So again, questions like with the micro lasers about, besides very high pricing, also questions without sterility, without proper decontamination between the patients.
Is there anything else you'd like to add?
Be careful with advertisement, look around, ask the questions, call us, call other manufacturers, look for drawbacks, look at pros and cons, and then make a right choice. That your laser will be really workhorse, but not just a toy, like micro laser, and you will show someone and then put on the shelf.
I have heard that the spectrolaser diode laser has been referred to as a very dependable workhorse. Good point.
That's true. That's true. Sometimes I send the orders for spare parts. I mean, for accessories, for consumables of the laser, and I look at that and say, this laser works from 2005, and nobody called me and said that, well, this laser doesn't work.
Mhm.
I'm so proud of that. But some lasers goes out down back to even 2001, 2002.
Thank you very much, Dr. Bekov. It was a
Oh,
pleasure
you're
to talk
very
to you.
welcome. My pleasure.